Lunch with the Doc. And today we're doing a special lunch with the Doc, not with the Doc, but with the Health and Balance team. This is Josh.
Hey everybody.
He does our home care, specializes in helping people do daily at-home exercises and stretches. They're going to help restore their posture. And today we're just rocking out to some good tunes, and we're going to give you some insight into home care and what you can do at home to relieve pain, restore posture, and just live your best life. So tell us about home care.
Yeah, so home care, like what Mo said, is really good. It's like homework for your body, for the stuff that we do here at Health and Balance is good to do at home to continue that treatment at home, and it speeds up healing. So we have a few things that we're going to go through today and talk about what each of these pieces of equipment do. The first is our cervical traction collar, which Sterling is modeling for us.
Here's our model.
The cervical traction collar is what we usually have patients start with because it's really good to warm up the muscles in the neck. So what it does is it lightly stretches and decompresses the vertebrae in your neck, allowing inflammation to reduce and allowing pain to reduce. So Sterling, you want to show a couple of the motions that you do with that on?
How does it feel?
Great.
Great.
So you're supposed to do this for about 2 minutes every day. 1 minute going one way and then 1 minute going the other way. Good, thank you, Sterling.
Helps to rehydrate those discs, give the proper space that you need. A lot of people have herniated discs or just pinched discs in their neck.
The next is a prolordotic, and this is really good for getting the curve back in your neck. It also strengthens the muscles in the neck. So, Sterling, how do you do it?
Well, we have a couple different exercises that we can do. We can do the yes and the no's, and those are basic for strengthening the muscles in your neck. So these are what the yeses look like. You can do those and try to reach up to 50 or 100. And then these are the no's.
Yeah, so you'll eventually work up to high repetition numbers like 50 or 100, but we usually start patients off at about 15 repetitions, just to get your neck into the motions and so that you don't start off with a lot of pain or soreness doing it. All right, the next one is the den roll. And almost everybody comes home with a den roll. This is what's really gonna help put the curvature back in your neck. Gravity does a lot of the work for the den roll. You just lay back on it. If you're laying down, it's gonna go about right there, and your neck's gonna form around this curve right here, and it's gonna help put your vertebrae back into place and get that curvature back that you want.
A lot of us lose curvature in our neck because we are texting, we're looking down. There's actually a medical term now for texting neck because so many people have this problem. We are at our computers and we're looking down and we're not doing enough exercises and strengthening to go backwards. So that's what the prolordotic and the den roll really help with. So we have those things, and then another thing that really causes postural distortions is adhesions in the muscles. So that's places where maybe we've gotten injury and we've overstretched the muscle, and then our muscles are trying to heal themselves. So they'll lay down scar tissue in that area, but they'll lay it in a like a crisscross pattern, and then there's a nerve that goes in between each layer. So during that restorative phase after injury or overstretching, that's when those adhesions are being formed, and then those will, like let's say I have adhesions in this side of my neck, it's gonna pull my neck to one side, and that's gonna just distort my posture. So this and this is the hyperise. Oh, this is the Viper, and this is the hyperise. So these are different like vibrating machines that are used to help get the adhesions out of your muscles. So like this one, you would turn it on. Oh, turn it on over here. See, he's the expert. And then it's like this, and it goes to higher degrees. So like just like a foam roller, you would use that on the ground. You would roll this like on your, let's say your leg, had some adhesions, you'd roll it there. You can roll it on your low back. You can use it on lots of spaces. So you just use it just like a foam roll, but it's vibrating to help break up the adhesions. And this one is the Hyper Ice. So similar to the Viper, but this is a ball, so it just kind of can help go into different areas. It's really good for like in the hip area. You can use it for the shoulder, lots of different places. But same thing here. You turn it on, it goes up in power, and it's a nice little massage, at-home massage.
Yeah, so the vibrations are really good for getting deep into the muscles. So if you come in and get treatment, a lot of the times they'll use the DMS on you, which stands for Deep Muscle Stimulator, and that's what this does as well. So if you get one of these, you can pretty much do that at home and localize it to one specific spot that you need on your body. That's what this one's good for. That one's really good for rolling out muscles like your quads, your hamstrings, or even your full body spine.
So how is our home care different than people just like doing exercise at home?
Home care is specific to each person, so the doctor will actually look at your x-rays individually and customize a home care especially for you, targeting whatever areas you might need. So if you have a lot of neck pain, they'll do more neck exercises, or lower back pain, they'll give you some exercises for your lower back.
And sometimes you don't know, like maybe your neck is distorted this way, and we're going to do specific stretches to one, like stretch this side and then strengthen these muscles. So we do a lot of things to help rebalance, and you don't really know necessarily what your body needs until we take those postural x-rays and find out what your specific distortions are. So that's why home care is really specialized, customized to what you need. And when you put home care together with, it's like home care and then your in-office treatments, and they go together and they work like these gears that are moving and helping you get towards healing. So when you combine them, the results are really amazing. Yeah? So that's home care. Come on in, we'll give you some home care and help you get better quicker. We're also having a 7 steps to relieve neck and back pain workshop on the 25th. So it'll be at 6:30, dinner's provided, and at that workshop we actually show you some of these things, give you some hands-on tools that you can use at home to be relieving pain. And that'll be on the 25th, so sign up, and thanks for joining us for another Lunch with the Doc. Happy Wednesday.
Happy Wednesday.